you? Good. Can you just tell us a little bit about what we did for you initially and why you came to see us?
Okay, well, Dr. Cockley had been mentioning to me about my extreme lingual frenectomy problem. I was very tongue-tied all the way almost to the very top of my, well, actually, now that I look at it, the very tip of my tongue.
Right.
And I had been going back and forth about getting the procedure done because I never really thought of it as a problem because I had already all my life. I'm almost 27. I've just been accommodating for things all my life.
Sure.
But she insisted that it was an issue, so I said, all right, I trust you, and we got it done.
And you did a lot of research?
Yeah, I did a lot of research on my own, and it was a really simple procedure, even though I was really nervous about it. There was really no reason for me to be nervous about it. The healing process was so simple. I know we talked on the phone, I guess about 2 weeks, and it was a piece of cake. I mean, it's amazing how easy it was.
Oh, that's wonderful.
Yeah.
We love when patients like you have such a good experience with that.
Yeah.
Tell us, you're here for about 3-week follow-up today
Yes.
with Dr. Cockley. Tell us some things that you discovered that maybe the benefits you didn't realize and what has changed for you.
Sure. I didn't realize how much tension I was carrying in my neck and shoulders before. I noticed it at sometimes, but I'm a teacher, so I just chalked it up to stress. You know, I was like, oh, that's where I carry my stress. Now that this is done, it took a couple days, but I felt complete relaxation in my mouth. Like, I don't feel myself tensing up anymore.
Awesome.
I'm completely relaxed.
Right.
At nighttime, I didn't realize I was breathing improperly. I always breathe with my mouth open, and I thought that was just normal, but now I don't do that anymore, and I can breathe so much better. I just feel it through my nose now, the airways.
Now you're breathing the way that everyone's meant to breathe.
Yes,
You just didn't realize.
Exactly. I didn't realize it before, and it's amazing. And clenching my jaw, I always used to do that, and I don't notice that anymore either. So.
And you also mentioned something fun that you've been trying that you've never been able to do.
Oh, licking an ice cream. Yeah, I never eat an ice cream.
And you've had a couple so far.
Yes, absolutely.
And the experience is great.
Yes, I went out with my mom the other day actually, because I don't get to see her very often. We went out for ice cream. I was like, Mom, look what I can do, and she's like, you're crazy. But,
so just real quick, can you tell everybody who might be listening, what advice do you give them? You know, you had a little apprehension, you did a lot of research. I mean, what would you advise others who have the same problem?
I would advise that if you have the problem, that you should get it fixed, whether you think it's a problem or not. Because I was probably that typical case where I really had no problems whatsoever. I didn't think anything of it. I had accommodated for stuff. My speech was fine. I was functioning fine. Everything seemed fine. But now that I have gotten it done, it's just such a different realization because everything is so much better. And I didn't realize that it could be better, I guess, you know?
Right, exactly.
And as far as the procedure, it is a little intimidating. I'm kind of a wimp when it comes to that kind of stuff, but really it's so simple. It takes about 10 minutes total, I think. The healing is not even a pain, like the incision part. I could touch it, it felt fine. That wasn't the problem. The problem was just a soreness, because it's like you're working out at the gym, and then your muscles are sore. Your tongue is so sore because it's never done that stuff before. But a little bit of Tylenol and a bunch of popsicles and you're fine. You know, like, it's
good
great.
Way to explain it, right?
Yeah, it's so simple, so easy. So.
Well, thank you so much for sharing, Jamie. I know we appreciate it and love to hear great stories like this, and I'm sure other people would love to hear the same thing. So thanks so much.
Thank you.
All right.